Hello and welcome to the Manifesting Health Series. I'm Curry Bordelon, your host for our discussion. The Manifesting Health Series provides engaging interviews with experts in men's health. Today, we're excited to have Dr. Jeffry Kwong join us for Inclusive Care for LGBTQ plus population. Dr. Kwong is professor and interim specialty director for the Family NP programs at Rutgers Health School of Nursing. He has extensive experience in caring for the LGBTQ plus population and is an expert researcher in HIV and the aging LGBTQ plus adult. Dr. Kwong is a clinical ambassador for the Centers for Disease Control and Prevention's Let's Stop HIV campaign, part of the National End the Epidemic initiative. Welcome, Dr. Kwong.
Well, thank you very much, Dr. Bordelon. It's a
So,
pleasure to be here.
excellent. Thank you for joining us. So, as we get started, tell us a little bit about yourself and how did you become so interested in that space for this very special population?
Sure. So I became just in terms of my background, I became a nurse because one, I come from a family of nurses, and I felt like this was sort of my destiny to work in this field. But also, just in terms of specifically in the field of HIV and LGBT care, I myself am a gay man, and um, I grew up in the San Francisco Bay Area and I was a teenager at the very beginning of the HIV epidemic, and I saw what was happening to my community and the people that I identified with, and I felt like if I'm going to go into nursing, and if I'm going to take care of people, I want to take care of my community and the people that I feel strongly for. And at that time, and even today, to an extent, many individuals who identify as LGBTQ or who are living with conditions such as HIV face stigma and discrimination. And it was something that I felt I could make a difference in. And so that has been my passion and has driven me throughout my career to really improve the health and well-being of the LGBTQ plus community and persons living with HIV.
Thank you for sharing, and I certainly appreciate all your extensive experience and the way you've continued to bring that forward. And because we need this in such a very positive manner, specifically now with some of the challenges that we're facing. So I appreciate all your effort. So as we continue on, can you talk a little bit more about the state of where we are? Where are we with the LGBTQ plus healthcare, with access to care, and specifically for men who are in this space who need care?
Absolutely. Well, I think we are in very dynamic and fast changing times. I would say, up until very recently, I can tell you that there have been tremendous advances over the last several years in terms of overall recognition of the importance of care that is inclusive and welcoming and is non-discriminatory in its approach to providing care. We know that many institutions and healthcare systems have really focused on being inclusive of, you know, asking about sexual orientation, gender identity in terms of electronic health records, in terms of patient assessments. There has been overall greater access to care. Again, up until recently, I think things will probably change or are in flux at the moment. So I don't know how things will be as they move forward in the next coming years or so. But I can say overall, if we look at the historical trajectory from, and I'm going to use 1969 Stonewall Revolution, right, as sort of our very beginning point of sort of the LGBT movement, there has been tremendous success and tremendous advancements forward, and hopefully that will continue, despite some, minor setbacks here and there. I think the overall trajectory is quite positive.
Thank you so much. And it is reassuring to see where we've come, especially more recently with medication regimen and where we are with access and also the availability of testing and so forth as one of the pieces, and also recognizing that for this population, it's more than just HIV. And so that's really important. And you mentioned it briefly. Can we talk a little bit more about the inclusivity of other elements within, when you're caring for your patients, the LGBTQ population? Obviously, we want everyone healthy and well and so forth. What are some of the other things that nurses and providers and family members can consider when you have a population, the male population within this LGBTQ community?
Sure. You know, obviously we know that there are health disparities and there are differences, and of course, as you point out, HIV tends to be the focus a lot of the times when we think about um, gay, bisexual men's health overall. But when we think about sort of LGBTQ health in general, I think it's really important to understand the intersection and the influence of other social determinants and the impact on overall health, especially mental health, is such a huge component and a major issue in terms of we know that on average, the data shows that individuals from the LGBTQ community experience greater rates of depression, of suicide, of substance use, of bullying and victimization from violence. All of these issues not only impact obviously mental health, but also has ramifications in terms of physical health. And so I think it's important to recognize when you're looking and examining and interviewing or assessing a patient that's in front of you to think of that individual um, in terms of some of the potential context or their lived experience and what and to touch upon and ask about, how people are doing in terms of overall mental health. How about just in terms of social networks and support? We know that oftentimes individuals who are LGBTQ may be isolated or, disengaged from their biologic family and may have their own families of choice or their own social networks, but understanding and making sure that people have appropriate social support and looking in and talking about those aspects of health are so important as well. And then just in terms of other things to think about, we think about prevention and health promotion. Again, sexual health and HIV testing, always important as well. But we also know, one of the ramifications of fear of discrimination and stigma in the healthcare setting is that people avoid care altogether. And so, in terms of preventive health screenings, such as cancer screening, right? We know that there's some data that shows that individuals, especially among lesbians, there's higher rates of cervical cancer, in part because, or more advanced cases of cervical cancer, in part because people are not getting screened because they don't want to um, experience some of they might have had an experience that was not so welcoming or favorable. And so they tend to avoid accessing care. And so just making sure as nurses, as healthcare professionals, that we think about, holistically treating any sort of acute illnesses, thinking about the individual in the context of the community, of a family, of the support system, and also thinking about preventive health and health promotion and wellness altogether. So I don't know if that answers
No,
your
certainly.
question.
It does. It certainly does. And it brings to light a couple of points I want to not only drive home with, but at the same time to talk about how important they are. You mentioned a couple of things that were really important, one of which is the preventative care side. When individuals specifically in a community like this and other individuals, whether it be, race, gender, age, you can go down other characteristics who are not welcomed within the health system or welcomed within the health environment, then they feel an obstacle in that healthcare setting or in that healthcare environment and less likely to follow up or to care for themselves or to do the preventative screening, all of which are evidence based, despite what you hear in whether it be social media or some of the news feeds. There's evidence that indicates by doing certain preventative techniques and certain regular preventative screenings, you can prevent serious life conditions that can be detrimental or mortal. So for us, we're trying to understand and we want to make sure others understand that every interaction you have with that patient is an opportunity to prevent something or to address a concern. So I'm so glad that you mentioned the preventative care piece. So whenever you're seeing your patients, is not just asking one of that targeted focus one item. It really is about asking other questions, those probing questions to get more so you have a better background story, but also care for potential other issues. But it makes that individual feel welcomed. Another thing you mentioned was also the mental health within this population, which we know is very difficult. It is extremely harmful in this population with years of, like you said, bullying and stereotyping and profiling and all these negatives. And it's created this culture in a way. Now we've been able to break through a lot of that, be able to normalize in a way. I say normalize, not, to be figurative, but to put it into a space where it's an everyday people around you. It's the same people. It's parents. It's teachers. It's fire department. Whatever it might be that are in this population. But we've been able to place people, to have people in our spaces that are all around us. But we
Mhm.
also have conversations about that. In that shift, we've talked about a lot of this progression over time. Where do you see us over the next few years or the next couple of years to kind of, I don't want to lose traction where we are. It's a struggle to kind of see where we're going to continue our efforts.
Right. That's a great question. And, I wish I had, uh, you know, a magic insight into sort of seeing where we will be in, it's 2025 now, where we'll be in 2029 or 2030. But, I think regardless of where things may go for 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 larger issues, I think the thing that I'm going to hold on to, and that I think we can, I'm hoping other people can do this too, is that, you know, um, we may not be able to change, the world. We may not be able to change um, things for, the entire country. But if we could work and change the lives for the people that we care for, we're making a difference. And we have to hold tight and hold strong to our values and principles and ethics as nurses. Our goal and part of our core ideology as nurses is to be the patient's advocate and to make sure that people are treated respectfully, that people get the care that they need, and that we, do what we can to make, um, even if it's one person or the 10 patients or whatever patients you see in your community or in your clinic or in your hospital, if you can make a change at that level and you can make that one experience there, if we all do it together, we will make big change. But and we shouldn't, get overwhelmed by kind of other noise that's out there in the stratosphere. But just if we can make those things, m- my goal is to make sure that right now, at least for the patients that I care for, I tell them, um, you know. whatever happens, I promise you that I will do my best to get you the care that you deserve, that's that you would that's due to you. So, I mean, I can tell you just anecdotally, um, I also care for a lot of individuals with transgender experience, and they've come to me recently with lots of questions and um, lots of fear, and and I sit there with them and I say, again, kind of just what I just said, which is I don't know what's going to happen. Um, uh, but whatever happens, I will make sure that you um, get the care that I can give to you and provide for you, that's within my scope and within my powers. So, I just need you to continue to trust in the system with me, and I will do my best to be your champion. And I think that's the message that's what I can give right now. So,
Certainly, and I appreciate it. And I want to applaud you for your integrity, but also your commitment to advocacy. And so there's a strong language which you just shared with us. It's the again, it goes back to what we both talked about earlier is every interaction has meaning. We may not be able to completely fix the whole thing, but every interaction has meaning and that meaning has value. And so I appreciate again your integrity in this, but also committing to your patients the right thing to do. And it's the right thing to do is to offer care and provide care and be steadfast with care for all. Nowhere does it say care for only. So that's what we have to remind ourselves. We as nurses, we as advanced practice nurses, we as leaders, we as advocates, as part of the healthcare community, it is our responsibility to make sure this population or all populations are treated fairly, but also are provided the same level of care as others. So thank you so much. As we wrap up today, and it's really been a great conversation. I really appreciate your time. Do you have a quick takeaway? What is something you want to leave with our listeners?
sure. So, I think the most important thing is to, um, and I will speak as a healthcare consumer, as a gay man, um, w- and what sort of really was the pivotal piece for me, in terms of my commitment and drive to this, is that y- you know, words matter. And just to be mindful of the words and the language that you use in either interviewing or in asking about doing your health assessment or asking about someone's health and well-being, is to just be mindful about the words that are being used, because I can tell you sort of the impetus for me was a really bad interaction that I had as a patient getting care from a provider who was not LGBT friendly or welcoming. And it was very stigmatizing. And it was the slightest thing that she said to me, but it stuck. And so I'm just gonna say, if there's anything that you can sort of take away, is just to remember words matter, and to just be mindful of the language, and to be inclusive and welcoming and unconditional in your approach.
Thank you, Dr. Kwong, so much for your insight, for your advocacy, for your commitment to your patients, and also for your time with us today. We really appreciate you sharing with us. Thank you all for joining us for the Manifesting Health series. We look forward to seeing you next time.